Hello, everybody. My name is Sally Agallo Kwenda. I live in Kenya, the capital city, Nairobi. I wish to share my story with you today of what I've gone through in life. Today, I am 53 years old, and not many women like talking about their age because of, I don't know why, but for me, I've gone through so much, and that is why I am never ashamed to say how old I am. And this is because in the year 1999, I thought I would die, or I actually attempted suicide as a result of having been tested for HIV, and there was no counseling done. So the person who gave me the result just said, you have HIV, or it was actually AIDS that time. And I knew that I was going to be wrapped in a black polythene and buried, so I didn't wait for that. Since I was living in Mombasa, I chose the ocean as my burial site. In the middle of the ocean, I dived. I'm a non-swimmer, but I dived into the ocean and hoping to die. But God had his own plan, so I was rescued. And from there, I was saved and taken to the hospital, of course, first aid and everything that happens. And because attempted suicide is like murder, I was to be arrested. But I told them that give me an opportunity, because when I was in the ocean, I had a vision. God spoke to me and told me, I want you to go and save my people. If you think you have issues, go and see how much other people have. So they thought I was a mad woman, and they called a psychiatrist who talked to me and said, okay, this woman is depressed. The reason why I was doing this is because I did not get support from my husband. By then, I'd lost 2 babies, one at 2 months, another one at 7 months. And my husband did not give me any support at all. And all I faced was stigma from my in-laws. And I thought the best thing was to die, because I did not have any kind of support from them. I really thank God for my sister, my family. I'm a last born, and so my sister and my other siblings really took good care of me, and I must appreciate that. I also want to appreciate MSF, Medicines Sans Frontières Belgium, who took me in because of my story. I know some people are sacked because they have HIV. I was given employment because I had HIV. They trained me as a HIV/AIDS counselor, and today I'm glad that I can talk to other people. The challenges I went through is treatment. At that time, there was no anti-retroviral treatment, and it was very expensive if there was any. The only drug that was there was Septrin, and I'm allergic to sulfur, so I wasn't able to take that. Miraculously, I got better, I got okay, and I'm happy that I'm here today to share my story. So when I was with MSF, we went through we had a very good medical cover. And at some point, I was screened for cervical cancer, and actually turned positive for the human papilloma virus. And further tests revealed that it was actually cervical cancer, and it was already in stage 2. It was another shock for me because I had already lost 2 babies. And so the doctor is telling me that for us to do this, we have to do an immediate intervention. And that meant that I was to do total hysterectomy, removal of my womb and everything else. For 2 months, I could not believe that that was happening. But anyway, I went for that. I accepted, signed the consent with him. That time we had already come back with my husband. We signed the consent and the surgery happened. But as soon as that happened, my husband could not take it, and he left to go and look for another, or to look for another relationship, a woman who could give him babies, because I wasn't able to give him babies. That is stigma that I faced. It wasn't easy for me, but yeah, that is how life is. Sometimes people say that when life throws lemons at you, you can make lemonade. Sometimes even that, picking those lemons and making the lemonade, the strength sometimes is not there. At that time, I did not have the strength. As if that was not enough. In the year 2007, I couldn't believe that I could not have babies anymore. And so the follow-up continued. And unfortunately, in 2010, again, I was found to be having colon cancer again, because I did not go through radio and chemotherapy because of my immunity that was very low. So unfortunately, I got cancer again in 2010, and I've now lived with a condition called ostomy for the last 13 years, and it is permanent. Getting ostomy pouches in Kenya is a very big challenge, and so I formed an organization, Kenya Ostomy Association, to be able to support such people. And at this moment, I would also wish to address policymakers. And I would say that so far I've been talking about my own story, but there are many other people. If anyone else was given this opportunity, I believe they would share their stories. So it's not just me alone, but many others. Yeah, so in fact, there's more and more people living with both HIV and cancer. I'm not alone. As the global population of people living with HIV is living longer, thanks to increased access and uptake of the ARV treatment. The risk of non-communicable diseases, including cancer, cardiovascular diseases, depression, and diabetes, this will only increase. At the same time, evidence shows that women living with HIV have a 6-fold higher risk of cervical cancer than women without HIV, as well as higher risks of recurrence, that is following treatment. In 2018, around 5% of all cases of cervical cancer globally were attributable to HIV, which 21% of those in the region were from my own region, Africa. Faced with this reality, there has been growing recognition about the importance of integrating NCDs and HIV response, with the adoption of high-level political commitments calling for the integration of HIV services in NCD screening and treatment for people living with HIV. In the political declaration of HIV and AIDS adopted at the UN General Assembly, which happened in the year 2021, governments committed to ensure that 90% of people living with and at risk of and affected by HIV have access to NCD prevention and care services, including for mental health by 2025. I hope I live to see this happen. In doing so, governments, with the support of global health organizations, donors, and private sector and civil society, must coordinate, fund, and drive local context responsive agendas for HIV-NCD integration to achieve the 90% integrated care target, which emphasizes person-centered care and considers the whole care cascade, from prevention and diagnosis to treatment, and as well as retention. One of the reasons why I'm sharing my story is precisely to sensitize policymakers about the importance of taking a context-specific approach for NCD integration and of listening to their communities' experiences and needs when designing their national policies and strategic plans. This is important not only to identify barriers of integrating NCD services into HIV-specific programs, but also to think about the opportunities to scale up these programs to the wider population and supporting health systems work towards achieving the ultimate goal of universal health coverage and ensure no one is pushed into poverty due to out-of-pocket payments in healthcare. The impacts of integrating NCD services into HIV programs can have a positive impact from a clinical point of view, associated, for instance, with earlier diagnosis, access to medication and take-up of treatment, but also from a societal point of view. Consider the cost of associated, consider the cost associated with traveling to clinics, travel-related meals, childcare and elderly care, and also loss of work opportunities. But the need for a people-centered approach and context-specific approach to integrated health services has also been acknowledged by the global coordinating and funding institution for HIV and AIDS, such as the UNAIDS, PEPFAR, and the Global Fund, and reflected in their multi-year strategies. This moves towards a people-centered approach is fundamental to break siloed approaches to funding and implementation of integration programs. In fact, all stakeholders must advance and share the evidence base on equitable, impactful, cost-effective, gender sensitive and age responsive integration strategies to meet the growing needs for prevention, treatment of people living with HIV and cancer, as well as NCD more broadly. This is why I'm talking to you today and sharing my story. I wish to inspire people who may be losing hope and to urge policymakers and health system funders about the challenges and importance of adopting an integrated approach to disease prevention and management. I thank you all for listening to me and wish you a very productive discussion.